Hello. I'm coming to talk to you two doctors in particular that may watch this video or may not. Today I had 4 wisdom teeth extracted. I just want to say something quickly about listening to your patients. Today I went in, my appointment was at 11 o'clock. I went in, everything happened normally as it should. When I got back to the doctor's chair, I was prepped and reminded of the procedure to take place. As the procedure started, I told the doctor that I'm very, very sensitive, and I'm sure he's heard that quite a lot, or even so just before. I expected his response of, "Oh, don't worry, I'll make you comfortable," which he offered. When he started, he numbed me. He used an anesthetic, and then he left for about 30 minutes. When he came back, I told him I can feel, and I knew that my sensitivity was not compensated with the anesthetic that he provided. As I've gone to the dentist before. He then proceeds to go, "Okay, I'll give you a little more." He gives me some more. Now, one of my teeth, had a really bad infection. Not because I didn't take care of my teeth. I brush and floss daily. But I've had cancer twice. And one of the side effects of my treatments, the radiation, the chemo, it can damage the bone of your teeth, or the teeth in general, basically, making them very weak, and I guess destabilizing the bone that hold the teeth, or the gums, whatever. I'm not a dentist. So, the bones in the jaw, sorry about that. So anyway, it can mess up your teeth and cause you to have a lot of issues. Bottom line, he knew that I was a previous cancer patient, and he proceeds to extract 2 of the upper. When he gets to the lower right, he starts to do the drilling or whatever the beginning of the extraction is, and it hurts like hell, and I pull away. I'm his last patient, or second to last patient of the day. I'd already noticed that when he gets to his last patient, he's always in the ready to go mode, and I tried not to pay attention to that, and I said, that really hurts, I can feel it. And he goes, "You don't feel anything, you don't feel pain." And I said, "No, I feel pain." "No, you're just nervous. You're just nervous and you're shaking, and you can't move like that." So I soldiered on. I said, "Okay." At that point, I'm shaking. And he starts again. And I said, "I'm so sorry, I can feel it, and it hurts very bad." He then, "You don't feel it, but I'll give you some more." He gave me some more anesthesia, or numbing agent, excuse me. When he does, he comes back. He goes right back in. He numbs it and then starts again. Of course, it hurts again. And I'm like, it's still hurting. It's hurting really, really bad. This one tooth. At that point, he's already pulled 2. So why would I have 2 pulled and really complain about 1 when you've numbed it the same way you numbed the others? So I said, let me try to just grin and bear it. He took that drill and stuck it wherever he did close to that tooth, and I almost jumped out of the chair. "You don't feel any pain. You don't feel pain." That's exactly how he did it. And I sat up and I turned to him and I said, I've had stage 3 Hodgkin's lymphoma twice. Almost died. I know what pain is. I've been sodomized as a child. I've been in endless fights. I know what pain is. I've been robbed at gunpoint, beat in the head with a baseball bat for over 30 minutes, almost lost my life. I know what pain is. And for you to sit there and tell me that a subjective thing, because that's what pain is subjective. Only a person can say whether or not the pain is there, not the other person. I said, for you to say that is so diminishing to the patient, and that's not fair. And he says, I'm not diminishing you. I'm just telling you with experience I've seen. I said, no, you're diminishing it. And that hurts more than the infection. That hurts more than the extraction itself. And there's no anesthetic to cure that, because you just ruined our professional relationship. The patient-provider relationship has been ruined. I trusted you not only to perform a professional service, but to treat me with dignity and acknowledge me. And you didn't do that. So that tooth was left unfinished, and he sealed it. And then he goes on to say, after I said that, he says, well, I'm not trying to diminish you and I'm sorry. And obviously feeling guilty after I gave him my whole medical spiel. And the assistant just lowered her head. And he says, I'm sorry, let me just numb it again some more. And I said, okay. And I said, before you do, I just want you to really understand, I'm sure I'm not your first, but please don't ever diminish someone's pain. My message to everybody, doctors, whether you're a dentist, a gynecologist, whether you're a gastroenterologist, whether you're just regular family practice, or an ER doctor, neurosurgeon, cardiologist, a dermatologist, if you're a provider, even if you're a CNA, nurse, respiratory therapist, because I myself am a nurse, something I have not yet to share with him, because it shouldn't matter. If you're any of these providers in any of these space, especially a doctor, you can't be taught humanity or bedside manner. You have to just have it. Terrible bedside manner hurts worse than the pain does. It's insulting. There's no anesthetic, there's no antibiotic, antiviral, or any type of cure for that. It stays with the patient and the person. And now I have to have that on top of a half-chipped, not removed, infected tooth. And by the way, when I left, right before I left, he goes, oh, let's just take some time. I'm going to give you some amoxicillin. And I said to him, funny, the last time I came in when I had the x-ray and you saw all the things going on, why you didn't give me the amoxicillin a week before I came back to lower the infection, because it's a hot tooth. And he looked at me and he said, yeah, it is a hot tooth, yes. And I didn't go any further. Besides the way of his practice being a little off, he was not professional. He did not do his job as a provider. Not because of his training, not because of his knowledge, but because of his application of humanity. And I urge all providers, utilize all your skills and training, but right at the top, keep your humanity. Listen to your patient. Never, ever tell a patient they're not feeling pain. You have no idea what they've been through and what they're going through under your hand. Patients don't come back to doctors because they killed them. They come back because how they treated them. So I'm going to go ahead and heal up. And yeah, I just wanted you providers to know that. I don't know. Have a blessed day.